Thank you for joining us for our webinar, Treatment of Anaphylaxis, Removing Barriers to Using Epinephrine. I am Jennifer Gertz, Executive Director of Food Allergy Canada. Our Back to School campaign is underway, and as part of that, we want to help build confidence in treating anaphylaxis with epinephrine. While epinephrine auto-injectors are first-line treatment of a severe allergic reaction, people hesitate in using them. From research, we know that epinephrine is underutilized for treating anaphylaxis in community settings, meaning prior to going to hospital. Also, some of you may have seen in the news the recent approval by the FDA for a nasal spray epinephrine. We're going to touch on what that means for Canada later in our session, but for the time being, today's discussion will be focused on epinephrine auto-injectors and removing the barriers to their use. We've brought together a panel of experts, including a leading allergist, a clinical psychologist with expertise on needle phobia, and an adult with food allergy for this conversation. Before we get started, I'd like to note a few items. Please note that this session is for informational purposes only and will not provide specific medical advice, recommendations, diagnosis, or treatment. Please talk to your doctor about any concerns or questions you may have regarding your health or the health of your child. All participants will be muted so we can keep the audio clear for the webinar. Thank you to everyone who submitted questions upon registration. There are some common questions that we'll tackle in today's session. If you have additional questions, please submit them in the question box throughout the webinar, and we'll get to as many of those as we can. And lastly, this webinar will be recorded and shared on foodallergycanada.ca afterwards. So a little bit about today's format. It's a bit different than those of you who've joined us in previous sessions where we have one speaker and then we have a Q&A. Today's session is a panel discussion where we'll be seeking the expertise of our panelists on addressing the use of epinephrine for the treatment of anaphylaxis. We're going to start with our allergist, where we're going to talk about confusion and concerns, confusions on signs and symptoms, and concerns on safety and side effects. Then we're going to turn to our clinical psychologist on the topic of fear and anxiety, including the fear of needles and anxiety and emergency management. And then we're going to go to our expert in the lived experience, an adult with food allergy who can share with the audience the approach they have taken to overcome their own barriers to using epi. We'll also be addressing questions throughout, as I mentioned, so please continue to put those, for those of you who are online and viewing today, feel free to submit those throughout. And what you're going to find through this conversation is that some of the common myths and misconceptions that exist around epinephrine and auto-injectors will be covered in the conversation. So I'm going to ask our panelists to turn on their cameras, and I would like to introduce them. I'm so grateful that you could be with us here today to share your expertise. First, I'd like to introduce Dr. Harold Kim. Dr. Kim is an allergist and adjunct professor at the University of Western Ontario and an assistant clinical professor at McMaster University. He also is the past president of the Canadian Society of Allergy and Clinical Immunology and is also the co-leader of the National Food Allergy Action Plan. I'm going to turn my camera on and off because I see that I've frozen, so please bear with our little technical gaps as we deal with enough pipe on our Wi-Fi. So we also have with us Dr. Katie Birnie, who is a clinical psychologist and an assistant professor at the University of Calgary. She leads Partnering for Pain, a patient-oriented research program that addresses top priorities for equitable and quality pain management for children and their families. She's the Associate Scientific Director of Solutions for Kids in Pain, called SCEB. It's a national knowledge mobilization network that works on improving evidence-based children's pain management through coordination and collaboration. And lastly, we have Michael Sawyers. Michael is an adult with food allergy and has navigated having anaphylaxis and administering epinephrine. He's also a mentor for Food Allergy Canada's Allergy Pals and Allies program for youth, and he's also a member of our youth advisory panel. Thank you all for joining us. All right, so I'm going to start with you, Dr. Kim. I want to first start with just some context setting around the role of epinephrine in the context of food allergy. You know, what is it and how does it work? And then we'll get into those barrier questions around confusion on signs and symptoms. So if you can set the context for you for this conversation.
So epinephrine is really the only treatment that we have available to truly treat anaphylaxis. So essentially what the drug does when it's injected is it reverses the reaction by improving blood pressure, improving breathing, improving breathing. It removes the skin symptoms that occurs, improves the gut symptoms. So essentially, it works immediately. It almost always works, and sometimes we have to repeat the dose if the reaction is rebounding or is more severe than one dose can manage. And it's generally very well tolerated and safe when it's given appropriately. And I think you'll hear through this discussion, certainly you hear from me, that we should be encouraging people to use epinephrine when needed because it's well tolerated, it's safe, and the only thing that really works. So I think that will be a theme through the discussion today.
Okay, well, let's go into those the slides that kind of we've put together just around the signs and symptoms, because there is confusion around, what are really the signs and symptoms of a severe allergic reaction? How do I know it's anaphylaxis? And then what do I do if I'm seeing that? So I think you've got a few slides that you'd like to walk us through. So I'll turn that back to you then, Dr. Kim.
Thanks, Jennifer. And by the way, thanks for organizing this and inviting us to attend and participate. So we've tried to present a few slides at the start that will try to simplify what we should be thinking when we're thinking about anaphylaxis. So essentially, it's a reaction that occurs almost always when somebody's taken a known or been exposed to a known allergen. Often it's a food, but it could be a drug or an insect sting or an allergy injection that we give in our clinics. And the symptoms that occur, about 80 to 90% of patients will have skin symptoms. And then if it gets beyond the skin only, then there is a risk of having shortness of breath, breathing symptoms, as well as cardiovascular symptoms. And with those symptoms, they can actually be life-threatening and severe. So we would recommend trying to avoid the triggers as much as possible. And then next slide, please. Typically what happens with these reactions is that the symptoms occur almost immediately after allergen exposure. Sometimes it can last and start after that. So if it happens after 30 minutes, we often will question it, but even up to 2 hours after exposure, we can see symptoms start. And typically we see that patients will have at least two of the symptoms or systems involved as we've discussed. Sometimes though, and we actually get quite concerned when we see this, is that you can sometimes have just the blood pressure affected, and that's with typically a known allergen. So you get exposed to a known allergen and you get blood pressure only, and often those reactions can be more severe. Next slide, please. So what we typically recommend when somebody is having an anaphylactic reaction is that we recommend that epinephrine be given. And in Canada, essentially, outside of a hospital setting or healthcare setting, it's usually almost always with an auto-injector. And so we have a few products available. The EpiPen device is the one that's essentially shown here. So if you're lightheaded or dizzy, we recommend that you lie flat if you can. And then the epinephrine device, and I have an auto-injector, a practice device here. So essentially what you do is you remove the safety on the end, you hold it with your hand like this, and do not put your fingers near either end because you could inject yourself with the auto-injector, which we don't want. And then as described on the image, we actually don't recommend that you swing it and hit it hard into your thigh. You can hold it on the anterior and lateral side of the aspect of your thigh, mid-thigh between the knee and the hip, and you just press until the device clicks. So if this is the leg, it'll click, and then you just hold it for 3 to 5 seconds, and then you let it go, and the needle will be protected within the device. And then we recommend that you call 911 and go to the hospital. Some of us are recommending that the device that you don't absolutely have to go to the hospital if you're having a really mild reaction, it responds to one dose of epinephrine and then and you recover quickly. But if you're having a severe reaction, then we do recommend that you go to the hospital, call 911 immediately. And officially on the product monograph for the epinephrine devices, it is recommended that you call 911 and get into the hospital.
Okay.
Next slide.
Um, okay, so thank you, Dr. Kim. On like going back to the signs and symptoms piece, how do you advise your patients on that? Is it serious enough, right? Because I think that's the question is like, do I really need to use this? Like, and maybe it's, a couple of hives and feeling the stomach pain. Like, how do you advise your patients on that question around when do you think it's serious enough that I have to use the auto injector? That's the time old question.
So what I would suggest that if there's ever any question and you're not sure to use the epinephrine device or not, it's safer to use the device and and then do the other things like calling 911 if needed. If you have breathing symptoms, lightheadedness, um, significant gut symptoms, then I would strongly recommend that you use the device. And I always tell patients, as I've mentioned, is that if you're not sure, use it. It's well tolerated. It generally will not lead to any significant side effects. And again, it's the only product, the only treatment that really will really reverse anaphylaxis for you.
Okay. And then on that question of side effects, like typically when someone injects themselves, what do they feel? Like what are those side effects that just everybody would feel when they're injecting themselves with adrenaline?
So most of the time there's no side effects in terms of anything significant, but the drug itself can cause a feeling of anxiety. It can make your heart go faster, and of course the reaction itself could make you feel symptoms like that as well. But generally it's very well tolerated. Really, when it's injected as instructed, the risk of side effects that are significant are really small.
Okay.
And so we really are not too concerned. I've actually injected epinephrine into my own leg by mistake when I thought I was demonstrating a practice device. And you feel a little bit of a punch when it hits your, when I've given it to myself. I felt the injection. I didn't actually feel the needle go in. I did not have any side effects myself, and I was actually expecting it, to be honest. But I think most people really do not feel a lot. And in fact,
Okay.
within 5 to 10 minutes, you should be, of course, feeling much better once the drug starts to work.
Okay. Terrific. Okay. So thank you. I would now like to turn to our expert on pain and needle phobia. And so, Dr. Birnie, we'd like to hear from you on, what you've learned through your work about what's at the root cause of this and what can people do to try and overcome these fears? Because the fear is real. We hear it from our community. It's a real barrier to the use of epinephrine. So let's
Yeah,
turn it over to you.
sounds good. And similar to Dr. Kim, just want to say thank you for having me as part of today, and just um, kudos to Food Allergy Canada for listening to that ask, right? Because I think, and this as a priority, because I think needle fears, although very common, are often easily dismissed and minimized when they can be the greatest barrier actually to us being able to seek the medical attention or engage in the treatments that we need. So really appreciate the chance to be here. And maybe I'll start by just saying how common they actually are, because it can be one of those things that people minimize and kind of dismiss, because needles are part of our lives, right? Whether it's vaccines or whether it's blood draws for other medical treatment or diagnosis. But they're actually quite common in children. So about 60% of children deal with some level of needle fears. It's about 20 to 50% of adolescents, and 20 to 30% of adults will have some level of needle fears. So if it's not you yourself, but you're the parent of a child who might be dealing with food allergies, it might be you, right? And actually not your child. So really thinking about it's something that we need to address, I think, not just for the individual, but also those around them that are here to support them in terms of what they need. Now, that being said, needle fears are a range. It's a spectrum, right? So some people just might not like them very much. So they have some level of fear, but it's quite low. And it's only about 5 to 10% of the population that have very severe needle fears, or what we would call needle phobia, right? So it's really reaching that level of fear where avoidance, I don't want to have anything to do with this. I become very, very anxious when even talking about it. They're the people who right now are highly uncomfortable that this is even part of the conversation, and may actually not have even come today because that was so high, right? So if you're one, if that's you or someone there's some really specific strategies for that group, which I'll talk about, but strategies more generally, right, that can help everyone to minimize any pain from using an EpiPen or any other needle, as well as for low to moderate levels of fear as well. You asked me, how do they start? They can start from a whole variety of reasons. They can start because something very direct, someone's had a past negative experience, right? But they can also start because of how others around them talk about it. Just hearing about experiences of others or hearing about it as something to be feared can actually increase or induce needle fears themselves. So how we talk about it also really matters to youth and to adults. So I've put together just some strategies. The other thing I'll share with you is if we manage pain, that can help us to manage fear. These things are very highly related. The more fear we have about something, the more painful it can be. But lots of really simple strategies that everyone can put into place. And I think really important for those, how many people haven't necessarily used an EpiPen, but might need to. So how do they kind of prepare in advance to feel like they have increased confidence and strategies to support them should they need to do so? So I think I put together one first slide, which just lays out some of the things you can do before, during, and after the fact when to manage pain. These are all science-backed strategies, and actually researchers, psychologists, other physicians here in Canada are actually leading experts internationally in producing this great knowledge and evidence for what to do. So there are things we can do ahead of time in preparation. Let's talk about the strategies, what to expect. I mean, Dr. Kim already just went through some of the things, right? But even just getting information, getting education about what would I actually need to do in that moment can prepare us, not just in how to use the EpiPen and what would happen, but also the things around it. So how might I decide when to use it? What's the practicalities of using it, and what happens after I use it, but also the strategy. So creating a coping plan, should you need to use it, with some of the things I'll talk about during and after the fact. Those can even just demystifying what will take place, and creating that plan can really help. And particularly with younger children, but even teenagers, writing that out. You can actually write out my coping plan for using an EpiPen and write down the strategies that you want to use ahead of time. Maybe there's things you want to have with you or other things like that. So there's some really creating the plan can be a really important piece. So some of the things you can do during, sitting up is really helpful when you have needles. So not lying down, basically, is kind of what I'm suggesting, right? In some instances that may not be possible, and that's okay. But we tend to feel a little bit more in control if we're able to be sitting up, whereas we feel quite a bit more vulnerable if we're lying down, right? So that can kind of help to reduce our fears. In some instances, you can use numbing cream or topical anesthetics. It won't work with an EpiPen necessarily because it takes too long, right? So some of those numbing creams can take up to 30 minutes. So they may not be useful in this instance, but I shared it because it is a strategy that can be used for other needles as well. Key here, can also be distraction. So basically the concept behind this is that our brain can only pay attention to so much. So if we fill our brain with something else that's interesting, that takes our attention away from the needle itself, our brain is actually has less space to actually perceive any sort of sensation or pain that's happening. Distraction can be done very easily. People have phones. You can talk to someone and distract them, right? You can distract yourself in other ways, so that can be there. Again, there are other strategies out there. You could use it with an EpiPen. There's vibrating devices. There's one called the Buzzy that's approved in Canada. It would be something you'd have to carry with you, right? So again, I don't think you need it here, but just wanted to share that it exists. And essentially it goes next to the skin where the injection will take place, and it vibrates. So it interferes with the sensation that happens in your nerves to go along. And the ones that they typically sell usually are generally used for younger children, and they look like a bee or a ladybug. So they're a little more approachable. Using breathing strategies, right? So when we have fear, when we have anxiety, if we're having distress, right, from that food allergy response as well, working to regulate our body as much as possible. We were talking about this and leading up to this panel discussion that sometimes the symptoms, right, of food allergy can be not dissimilar from some of that anxiety feeling or fear response in our body as well. So often taking some deep breaths where we can be quite helpful to regulate that fear. For younger children, offering appropriate choice in terms of the coping strategies they might use, right? So you can go through with them and say, which would you like to do? If we're going to use distraction, what would you like to use to distract yourself, right? While we do it. Another strategy that we often our instinct, particularly as parents, to do is to engage in reassurance. I'm sorry, I have to do this, really apologizing and kind of engaging in reassurance. What we've learned through some really cool research is that when we reassure, it inadvertently actually communicates to children that there is something to be afraid of. Otherwise, why would you be reassuring me, right? So it's better to use that distraction, coping strategies, direct kids to focus their attention elsewhere, or to engage in deep breaths if they can. A small portion of people sometimes actually faint. So they get this vasovagal response in their body, which essentially is a rapid change in blood pressure, and they actually feel like they're going to faint. For those folks sometimes then it is actually preferred to lie down, or at least ensure that they're safe, right, in a position where they won't fall should they faint. But another good strategy is this tense and release. So it's actually tensing up your body. So your abdomen, for example, holding your stomach quite tight, and your buttocks and upper legs and your arms, tensing it for about 10 seconds and then releasing it, and tensing it and releasing it. And that can counteract that vasovagal fainting response in the body. So that can be a strategy that's quite helpful as well. But I think one of the things then, people are so relieved it's all happened, they often kind of forget that actually what happens afterwards really makes a huge difference for the future, both in terms of pain and in terms of fear. So I'll just encourage you afterwards, if you are in a situation then where you need to use the EpiPen, praise a lot, right? Like it is so wonderful that you used this when you needed to use it, right? If you weren't sure, you did the things you needed to do, you got through it, you coped, and you were successful. And I think that's really important. And I think it's important for everybody, not just young children, but even how we talk about that to adults, right? To youth and adults, coming from those around them. So that includes the health professionals, but other family members and so on. So it seems simple and it seems obvious, but it's amazing how much we don't do it and how much we can sometimes focus on, well, you didn't do it soon enough, or, all those kinds of things. And so I think really praising and reinforcing success, even if it's distressing, you can focus on what went well. So oftentimes we'll say with younger children, it's okay that you cried and you got through it. I saw you take some deep breaths. I saw you watch that video I was showing you while we did it, to distract you. You can still really focus on what went well. And part of why we do that is because how we remember an event actually has an impact on how it goes next time. So if we focus on it in a very factual, neutral way, or in a more positive way, we're less likely to experience pain the next time, and our fear is reduced. If we tend to focus on the things that didn't go well, it can actually increase our negative memories of that experience and lead to increased pain and fear subsequent times. So it really makes a difference how we talk about it afterwards in terms of how it sets the stage for the future. And again, this may seem, you might just be relieved, right? We got through this food allergy event, and that should be rewarded in and of itself, right? Everybody's okay. But no, it's also okay to bring in other things to say you did a great job. You got through something that maybe was hard for you, you hadn't done before, you were scared about, and to be able to acknowledge that, through doing small celebratory things or tokens or something like that kind of marks that success as well. So those are some strategies that can be useful, and happy to chat more about it. The other piece that I'll note on the next slide is just the approach that we take with very, very severe needle fears. So I mentioned this might be more for that 5 to 10% of the population that has a true needle phobia or very high level fears. This is what we call exposure-based interventions. And essentially, this is true for all fear, all anxiety. It gets fueled by avoidance. So if we avoid something, our fear actually gets greater. And what we have to do is kind of relearn in our brain, I can actually get through this. Now, the approach that we generally suggest is doing that gradually, right? So it's not necessarily just going right into the deep end, but building up our confidence and relearning in our brain, this is something that I don't need to be as fearful of in a gradual way. So this is a resource that I've adapted for this context. Anxiety Canada has some great resources. This is a very evidence-based approach for treating all sorts of phobias, not just related to needles, but across the board. And essentially, I've just done an example one here. They're really built in an individualized way because everyone might have different things that are more fearful for them than others, right? Usually we can start small by even just reading and talking about it. And we want to do this for long enough that our anxiety peaks, right? It comes up, it's going to increase as we talk about it. And we want to keep engaging in that situation or exposure to that environment until our anxiety starts to come down. So that might mean we need to sit and talk about it for a couple of minutes, right? Might be 3 minutes. We can set the timer. We'll sit and talk about it. We'll take a break. We'll do it again, right? And sometimes we need to stay at the same step before we can move to the next one because the goal is to have our anxiety decrease. So at each of these steps, we've come up with some examples to increase our exposure to the actual situation. With a fear rating from 0, I have no fear at all, to 10, worst fear imaginable. And we want to start with a little bit of fear, right? Because if we start with something that creates no anxiety or fear whatsoever, it's not going to help us, right? So we need to gradually increase that. So some of the examples I've done here, reading about an EpiPen or just talking about it, maybe carrying your EpiPen with you in your bag or your pocket for a period of time. For some people, that might just induce some anxiety. I know it's there, right? I don't need it. I don't need to use it, but even just having it around actually makes me a little bit fearful. So you just need to expose yourself to that, right? In a gradual way. Maybe just holding it, right? Holding it with the safety cap on. Maybe you just hold it with the safety cap off. Looking at pictures of an EpiPen, such as looking at the website, right? Or just Google imaging EpiPen, right? And kind of just spending some time looking at the pictures. You might watch a video clip of someone else using an EpiPen. My recommendation, especially for parents, is that if you're going to do that, Google and watch the videos first, right? It's really important that the video examples we see are of people who cope with it well, who are great models, right? Who are showing this is something we can do without having a very high level of fear. So those can be great, and you can watch those again and again. Maybe watching an apple or something else being injected with an EpiPen that's more in your real world as opposed to on the screen. Holding it, I mentioned, holding it with the safety cap on, but out of a carrier, holding it with the safety cap off, right, might increase it. Having someone hold the EpiPen against your legs with the safety cap on or with the safety cap off, and kind of increasing, you can see as we're going up here, we're increasingly mimicking what would actually happen in a given situation to increase that, almost like going through the practice steps, but not actually carrying it out, but bringing you as close as possible in the practice. And you might need to do, as I mentioned, some of these steps over and over again. So I've offered a lot here. Often
Yep.
I'll just say this is really supported by, ideally, if you can do it with a psychologist, they can support you or they can support your family in doing this as well. But I know, and we can chat about that, accessibility sometimes to a psychologist to do that can sometimes be challenging. So something to think about, and just kind of demystifying some of the best approach we use for high levels of needle fears.
All right, that's terrific. So I want to ask you one more question before I go on to
Sure.
Michael. Okay, and when sometimes what people are experiencing is the fear of a severe allergic reaction. They're the fear of anaphylaxis because they've heard that anaphylaxis is life-threatening, and it's kind of they're in, they want to deny that might be happening, and so it creates anxiety, and then that anxiety and that denial gets in the way of using the needle. So there could be compounding factors, but when you think about this, Dr. Birnie, that they're in a what could be an emergency situation or viewed as kind of an emergency situation, there's going to be natural anxiety. What's your recommendation there to overcome and kind of be clear-headed about, okay, step in to treat?
Yeah, it's a great question. Step in to treat themselves or someone else,
Or
Jennifer?
someone else,
Yeah.
either, right? And in some situations, and it's the parent, right, who doesn't want to cause what they might think is unnecessary trauma by giving their child a needle, right?
Mm-hmm.
And so it's
Mm-hmm.
like, well, is this really that serious enough, right? So
Yep.
that's one part of it, but it's also, and we'll get to Michael because he'll tell us about what it's like as an individual giving,
Yep.
treating yourself.
Yeah, I mean, I often think about our ability to undergo needle procedures, and I'll say people can have different fears about different types of needle procedures too, right? So you might have trouble with one and not another. So I'll just acknowledge that that can be the case. But they're also, I think, a really important life skill, right? And I think it's really important to think about framing it that way, particularly for people with food allergies. Like your ability to be able to use an EpiPen is an important life skill, right? In these situations, whether it's with others or whether it's on your own, because you may be in a life-threatening situation. And I suggest to both those thinking about it themselves, but also as parents, to think about it as one of an array of life skills that we actually think are really important for our children to learn, right? Some seem very benign, like learning how to do your own laundry, right? Or emptying the dishwasher, that are low stakes, but important life skills towards independence, right? And this is also one of those things, right? It is part of that care. The other piece I'll add is just emphasizing how we talk about it after the fact, right? How we talk about it ahead of time, creating that plan. This is something that we need to do to make sure that you stay safe, right? And make sure that we have a plan for what to do in those situations. Same way you might talk about, if you're walking home from the school bus and a stranger wants to talk to you, we'll talk about what's the plan for that, right? How do you stay safe in those situations? Or you get lost when we go to the amusement park. You're making a plan ahead of time for what do we do in this situation should it arise. It might not, right? And that would be great, but it might. So let's make a plan for that so that we know that we can count on each other, and we know what we're going to do, what's your job in how to cope in that situation, and what's my job as your parent in how to cope in that situation, right? And then how we talk about it afterwards, right? that might have been a hard thing. And wow, wasn't it great? We got through that, and we've learned we can get through that. How cool, you learned you were stronger than you thought you were, right? Or you learned, or okay, what can we learn for that to make sure we do next time because that was helpful? Or what might we want to try to do differently should that arise, right? So I think about it in that context, Jennifer. Um, uh, and I think there are lots of good, for those parents who are worried about creating, um, you know, um, uh, yeah, I just think about that comparison of being able to use an EpiPen with all of
Okay.
these great strategies that we had versus the potential consequence of not. These are things we can do to make sure that it goes well, and that even if it doesn't go perfect, we can increase how well it goes next time, right? Too. Yeah.
Awesome. Okay. Terrific. Okay. Well, let's go to Michael. Okay. So, Michael, thanks for joining us. Tell us a little bit about, your connection with food allergy, and what allergies you have and the situations that you've been faced with where you had to make that decision and how you kind of dealt with it.
Absolutely. Thank you so much for having me. Hi, everyone. My food allergies, I'm anaphylactic to dairy, egg, peanuts, and tree nuts. I'm 25. I live in Toronto, and there've been a lot of, I've had like, three major anaphylactic reactions that I've had to deal with. I've used my EpiPen 3 times. Um, and I know I've faced a lot of the barriers that we spoke about today. I've faced emotional barriers like that fear. I've faced psychological barriers, that anxiety between like, is this an allergic reaction? Is it not? I don't really want it to be. I don't want to have to deal with everything that comes after that. And I've dealt with some of the practical barriers. And I have a few like, stories just prepared in my head. And Jennifer, I'd love to chat more about them. I think the one thing that came to my mind first when I was thinking about what to share with everyone today was that emotional aspect, that fear aspect. So, I'm 25 now, but I was 18 at the time. It was my first year at university. I was in residence. I was away from my parents. Every day I loved residence. I'm so happy I went personally, but I did have an allergic reaction there. There was a mix up. Um, and it was so scary to deal with that. I got back, I was on the novice rowing team. It was like super early in the morning, and I came back and I had breakfast. And I remember I was feeling the signs and symptoms Dr. Kim was speaking about earlier. I had most of them there. And I woke up my residence advisor on the floor and said, I think I'm having, an anaphylactic reaction. And she was great about it. She's super, trained in these situations. And she said what we spoke about on this call. She said, if you need to use your EpiPen, you can do it. You know this best. And I thought, I do know this best. And I used my EpiPen. And it was great that I dealt with that, but I was very nervous. I was nervous during it. I was scared, especially after it as well. And it felt very stressful to have to deal with that after. And I think what I learned was, a few months later, I had another anaphylactic reaction, and it was just annoying. And I think that first anaphylactic reaction gave me that experience, and most importantly, that confidence to know that, yes, I have all these worries about using my EpiPen at the time, but after using it, I just really felt like, okay, I got this. And that first one was so stressful. I talked to my family, and then that next call was like, oh, I had another allergic reaction again. This is stressful, but it was an annoyance in my week instead of this very big situation.
That's awesome. So, Dr. Birnie, I'd like you to just jump in on that example and give us your sort of view on Michael's journey.
I'm, I mean, you said it best. I appreciate the chance to respond, Jennifer, but I think you said it really well, Michael, right? Like it is that anticipation. And I think, even the part that really struck me as you were talking was how well you use the support network around you too, right? And, like, again, that speaks to the preparation. Here's who I would go to if I needed something. Then they just encouraged me and I was able to do it. And how you persisted even though you were nervous and anxious about it, right? And I think that's a good reminder to ourselves too, that we can do things that are important to us, even when we're nervous and anxious about it, whether that's us as individuals or us as parents. But then how you said it later, yeah, and then that was the biggest hurdle. The first time was the biggest hurdle, and your confidence afterwards. So yeah.
Now, Michael, have you ever had a situation where, you've used your auto injector and then when you kind of reflect on it, well, maybe I didn't have to do that. And how did that feel?
Absolutely. And it felt confusing and stressful, but ultimately I was glad I used it. That sort of touches on that psychological barrier of like, after that first reaction, I mean, I was more sensitive to like, am I having an allergic reaction or not for a little bit after that. And, you know, and that anxiety can those signs and symptoms of severe anxiety can sometimes mimic the signs and symptoms of severe, anaphylaxis, and that can be a difficult thing to navigate. And I remember I was dating my then girlfriend at the time. This was shortly after the first allergic reaction, and she ate hot chocolate. She drank hot chocolate, and we kissed afterwards. And she said, "Is this okay?" I was like, "Yeah, it's fine." And I was in the moment, I was like, I don't know if I should, I don't think I should be saying this. And, that's part of that stress of like, trying, not wanting it to be a big deal, even though sometimes it is your allergies. And we kissed. And then, I went home and she went home, and I was by myself with, my roommates. And I was like, well, I'm starting to feel stuff. I'm starting to get really stressed out. I'm not sure if I should use my EpiPen or not. And I was at UWO, and my roommate was in medical science, and I asked his opinion. I was like, what do you think? He's like, when in doubt, you need to use this thing. I said, absolutely, I think you're right. And I used it, and I called 911. The paramedics came and they said, I don't think you're having anaphylaxis, but we're going to take you and check you out anyways. And I think, with that situation, I wonder, what if I didn't use it? And I'm happy that I did. And I'm happy that it gave me a chance to sort of remember that it's okay when in doubt to use it, and have that sort of like social license that I give myself, that like, it's okay to use that. And I think also, my roommates also got that chance to sort of observe the severity of anaphylaxis as people who don't have that. And they got to see, oh, this is a serious thing. It gets stressful to watch your own roommate call the ambulance and use an auto injector. And I think, ultimately, no one wants to deal with anaphylaxis, but those positives came of like, my roommate saw the severity, and I got experience telling myself it's okay to use it when in doubt.
So, Dr. Kim, I'd like you to lean in on this conversation too about that, because sometimes we'll hear from people in our audience who said, you know what, I was told I shouldn't have used the epi, right? You're an allergist, you're the expert in this. Like, what's your perspective, and what guidance do you want to give to the community when we sort of get that, I don't know that it was serious enough.
So I think Michael got across the point quite nicely that it's safer to use the epinephrine device than not use it if you're not sure. And you just illustrated the point that you know what, you gave it to yourself. Maybe you didn't need it. Absolutely didn't need it, but it's safer to do that. And again, that's what I always encourage. And a thought crossed my mind as Michael was speaking. We give a lot of food challenges to patients, often young children in our clinics, either in the clinic or in the hospital clinic. And even when children are having gut symptoms alone, but we're very convinced that that it's from a food reaction, without any breathing symptoms, without any cardiac symptoms, we give the epinephrine just to make them feel better, because those reactions are quite uncomfortable. So from a relieving pain point of view, actually, it's a good tool as well, and treatment as well. So, but absolutely, if you're not sure, give it, and then again, there's really generally no fallout afterward, aside from the question of whether you should have given it or not. But almost always, I would support a patient in giving it to themselves if they're not sure.
Okay. Now, on that sort of the blurring of symptoms around, anxiety can make us breathe quicker, and that also is a symptom of severe allergic reaction. How do you guide your patients on how to discern, is this anxiety, or with your asthmatic patients, is this asthma? or is
Right.
this a serious allergic reaction?
So often it's difficult to know between those issues, asthma, anxiety, allergic reaction. And again, if the patient or if a person is exposed to a known allergen, potentially like milk exposure, as Michael's illustrated, and there are some symptoms, then my personal feeling is assume that it's a reaction and treat it. Even if it's asthma without anaphylaxis, epinephrine is not going to hurt and probably may help as well in that situation. So again, the bottom line is to use the device if you have any question at all, because probably you'll feel better afterward, because usually you'll be right that it is an allergic reaction. And again, even if it's not, then there's generally no harm at all. And often, as Michael's pointed out again, is once you've used it, then there's less issue and problem and concern when it's required again later.
Okay, thank you. So Michael, I want to go back to you because we had some questions that I know that parents are going to want to hear from you, okay? Because we've got parents and healthcare providers that are dealing with teens, okay, and preteens,
Yeah.
and trying to address some gaps that are specific to them. And one of those things is like, how do you get them to carry their device? Because in some cases, they don't want to carry their device. So what's your suggestions on that?
Yeah, absolutely. And this is something I struggled with. My brother, also, I mean, I was the person trying to get my brother to carry his device when we were younger. And I've learned a couple things. One is that it can feel like a hassle. And I feel like a way to get rid of that hassle, that extra responsibility that none of us asked for as people with food allergies, is to just have EpiPens everywhere. Have one in your pencil case, have one in my back. I have one in my backpack. I have one on me at all times in my pocket. I have one in beside my bed on my nightstand table. And having a lot of EpiPens everywhere, what helped me feel like there was less to remember. If a mistake was ever made, I wasn't in a situation where I was out without one. If I, forgot it at home, there's one at the school or at the workplace. But maybe like a teenager workplace, I used a lifeguard. I kept one there, and I think that made it feel like less of a hassle. The second one was, and this one takes a bit of time. Sometimes it did for me, finding friends that got it and understood it. And if they didn't understand it, give them that benefit of the doubt to share it with them, and realizing the best friends stuck around, because I feel like for me, part of the hesitancy to carry the EpiPen wasn't just the practical aspect of remembering to bring something. It was that emotional aspect of like, I don't want to carry this big bulky EpiPen around and be the allergy guy and be the guy with allergies. And having friends who got it and understood it, I feel like I should have advocated for that earlier to my friends, but I was a bit too nervous, and I started to advocate for it later in my life. And some of my friends would be like, "Oh, Mike, do you have your EpiPen? Like, we're just about to go out," and like that felt so good. And I wish I asked for that earlier in some friendships. And I think, as a teenager, you want to fit in, you want to feel like you're in the group. And I think just finding friends who make you feel like you're in the group despite those allergies was really important to me personally.
Now, Dr. Birnie, I see you nodding your head. I feel like you have something you'd like to add some commentary on this one.
Yeah, no, I mean, all of those things make a lot of sense to me. And, depending on, what it's like, I know lots of younger children, especially, have been able to reclaim kind of ownership and destigmatize some of their experiences by doing things like class presentations, right? Here's me. This is why you can't eat this for lunch, right? Here's those kinds of things, and kind of having support in those situations, right, by providing a little bit of education to folks around them. And again, with supportive others, right, teachers, it also becomes about compassion and empathy, for other people generally, right? Because you might be the person who's dealing with a food allergy, but someone else in the classroom, has something else, right? And so, opportunities to share about that. And I think checking in, like I mentioned, in the fear hierarchy, is it a fear thing of having to use it? Is that something that needs to be addressed? Michael, you mentioned some other things, but sometimes it's just, I just don't like having my EpiPen with me I'm thinking about it all the time. okay, so let's address that, right? And that might need a slightly more gradual approach to build up to, as opposed to an all or nothing, right? So being able to build into that, and reinforcements around it too, right? It's something you need to do, but there's things that we get, small appreciations or rewards for, that are things we have to do sometimes in life too, right? So just thinking about how to reinforce that behavior that you want to see can go a long way.
And it seems like your examples, you've helped to overcome that fear that teenagers have of, drawing attention to themselves, in that kind of finding the supportive group around you. So that seems like a really great strategy through those teen years. Now, I'm going to switch gears a little bit, because I want to go back to Dr. Kim, and get back to this. There's another question that came from a youth, and I'm going to come back to you in a minute, Michael, but I want to go to Dr. Kim, and I want to talk about the size of this device. Okay? Because we hear from people, gee, this device is big. And so that inherently might put people further up that fear of the needle. Okay? So I wonder if you can help set the context, even though this is a large size device, when you compare the needle itself to childhood vaccinations, how does the EpiPen compare?
So thanks, Jennifer. The length of the needle and the device is large. For the pediatric or EpiPen juniors, the needle length is 13 millimeters, so about half an inch. And that would be very similar to any of the vaccine injections that a baby would be getting. And for an adult dose, it's about 15 millimeters, so about a little more than over half an inch, so about 60%, or maybe close to 2/3 of an inch. So again, for larger children, over 50 pounds or over, and adults, adolescents, adults, we're talking about an injection that is not very long or large, and so it's a fraction of the length of the device. Again, for children only under 50 kilos, it's only half-inch long. So
Okay.
it's
So it's, yeah,
not very
the
long.
right. Okay, because the device itself looks large, but that's not the needle. Right? The
Yeah,
needle's just a small portion of it. And the fact that it recoils is you actually don't see the needle in the end
yeah,
once
and
you've given it. So Michael, one of the questions we did get from a young person was, well, does it hurt? For 65% of our audience has never had an EpiPen. So that's their question. What's your thoughts on that? And then I'm going to ask you, Dr. Birnie, for some commentary on that as well.
For sure. So I've used my EpiPen 3 times. Um, I consider myself somebody who's quite pain sensitive. I go to the dentist and I'm clenching my toes. I really don't like it, like being there. And the EpiPen, like, my honest answer is, the first time I used it, I didn't really feel much. I had so much adrenaline going, I think, like just stress as well. Just my priority was to use the EpiPen and not feel it. The second time I used it, I felt it a little bit more. I think the important thing for me to share today is that, one, I think it's a subjective experience, as Dr. Birnie was mentioning, and it's different for everybody. But the most important thing for me was realizing that my priority was being safe in that anaphylactic reaction. And, you know, whether I felt a prick or to how much, to what extent, I don't really remember exactly now, because all I feel and I'm happy with that I used it and I followed the exact allergen protocols to keep myself safe. And I think that's my honest answer. The first time didn't really feel it. The second time felt it a little bit more. And in retrospect, I can't even remember in that much detail, because I think it went well, which I was happy about.
Dr. Birnie, any additional comments you'd like to add to that?
No, I just loved that you brought up how big is it, because I think when we see these devices, I mean, on the one hand, auto injectors have such great convenience, right, in terms of our ability to use them. But sometimes people actually, especially those that have higher fears, want to look and watch and see, and that's actually as opposed to distracting. And so the con sometimes of the auto injector is that you can't see it, and our brain fills it in, right? And when we're afraid of something, it fills it in a way that aligns with that fear, right? And so that's, in part, what makes it seem like, oh, it must be giant, right? And so it must, so I think demystifying that, what is that actually, is really important. And if it's useful for you, right, I agree, it's a very subjective experience, as are all needle procedures, right? There's quite a variety. And as I mentioned, just because you might be concerned or have fear around a different type of needle procedure doesn't mean you will here either, right? And doesn't mean it will be the same experience. But we do know there's that connection between fear and pain. You can hear. I'm just going to make it explicit because I'm just talking. I'm already talking about it. And so the more we can do to reduce that fear, it absolutely decreases the likelihood of experiencing pain associated with its use, and some of those other strategies that I mentioned, right? So again, that idea that our brain can only pay attention to so much. So if it's filled up with something else, and Michael, you gave an example of that, it was filled up with everything else going on, actually, that when I used it, it didn't, I don't even remember what it felt like, right? Because that was not the kind of salient piece in the experience for you. And I think that's a good example of where we can use our brain to our advantage, right? If we're using it in ways to effectively cope and focus on other things, our brain's preoccupied, right? And that actually we're less likely to experience a painful sensation around it.
Thank you. Okay, so we're coming up close to the hour. We're going to run just a few minutes over because we do want to have the opportunity to bring the audience up to speed on neffy and some of the discussions that are happening south of the border. But I want to have one question to Dr. Kim, and then I'm going to ask each of you to give kind of one final take-home message to our audience, and then we're going to talk a little bit about neffy. So first, the question, Dr. Kim, antihistamines. Okay, some people, I just want you to address the use of antihistamines in the treatment of anaphylaxis.
So if you're having symptoms that are fit into the images and discussion that we had at the start of this session, then epinephrine is the treatment. Antihistamines should not be used for anaphylaxis in terms of dealing with the important symptoms of it. If you're having extremely mild symptoms after things settle a little bit, say just a few hives, then it's not unreasonable to use a non-sedating antihistamine, but really it's as you hear when we're trying to emphasize things, it's epinephrine, epinephrine, epinephrine. Antihistamines really should be considered as for very, very mild symptoms. And there's never been any studies or proof to show that antihistamines help with true symptoms of anaphylaxis.
Yeah, and now when we're talking about antihistamines too, we're talking about not Benadryl, we're talking about second generation antihistamines. Yeah, okay, we've got lots of information on our website about that if people have more questions around the role of antihistamines.
Can I emphasize that, Jennifer?
Yeah.
One of the big problems with taking Benadryl is that it's sedating, and then in an hour, after the sedating effects kick in, potentially, then it can confuse things. So as allergists in Canada, I would say we almost never recommend Benadryl, always the non-sedating ones.
Okay, terrific. All right, so Dr. Kim, I'm putting you back on the spot here. One take-home message or a couple of take-home messages, and then I'm going to come back to you after on the conversation on neffy.
So I think a couple things. One is that, as we've emphasized, is use the epinephrine device if you need it, and if you're not sure, use it still. And another thing is I have heard from some patients over the years that sometimes they get into emerge, they've used their epinephrine device, and there's some criticism in the emergency department sometimes, or even with paramedics, that maybe you shouldn't have used the EpiPen, you kind of overreacted. Again, don't take that as a criticism. I would just not take that seriously even. Again, if you're not sure, use it. Because one thing we haven't mentioned is we don't know which way an anaphylactic reaction is going to go. And from a purely medical point of view, it's much better to take it earlier rather than when it may be too late. So absolutely use it if you're not sure, and obviously if you know you need it, then absolutely use it.
Awesome. Okay, thank you, Dr. Kim. Dr. Birnie.
Yeah, I think the general takeaway I would suggest is fear drives us to avoid something. So I would lean hard against that. And the more you can prepare and talk about it ahead of time and build those plans, it's going to support you or your child, you with your child, whatever that looks like when you do need to use it, if you do need to use it. So even though our instinct is to avoid and not talk about it, in the hopes it never happens, preparation is best in terms of being able to manage those situations well.
Thank you, Dr. Birnie. Okay, and Michael, over to you.
As Jennifer, you mentioned, I'm an allergy pal for Food Allergy Canada, helping young kids with the social obstacles of allergies. And I don't consider anaphylaxis as like obviously a positive thing, but I can't help but notice some of the things that younger people with allergies have. They're more independent. They learn from an early age how to advocate for themselves for something very, very important, and they are like willing and able to take responsibility and accountability for their own health issues and health obstacles, and that translates to other aspects of that. And so I just wanted to share that I really like to observe that. And the second thing about allergy pals is that I reflect back and I think my parents were my very first food allergy pal, and I just really respect and appreciate all of the work that the audience here today has taken to be part of the community, help their kids, help from a medical perspective in any other way. And it is really just an amazing thing that makes me feel happy that there's people out there like all of us in this call today that are working for food allergies. And I really appreciate
Awesome.
that.
Okay. Well, thank you, Michael. So Michael and Dr. Birnie, you're welcome to turn off your camera because we're going to just do a quick, and I thank you so much for your contributions here today. It was a really great conversation. Dr. Kim and I are just going to take a couple of more minutes just to bring people up to speed on neffy, and then I've got a few closing comments for the audience. So Dr. Kim, FDA, they've approved neffy, a nasal spray epinephrine system. So how does it work? And what's our thoughts on this this development?
So we have been very happy that it has been cleared in the U.S. from an FDA point of view. So it should be available in the U.S. Soon. And in Canada, we're optimistic that the company that has the neffy product is going to bring it to Canada, and we'll see over the next few months how that progresses. But essentially, instead of an injection of epinephrine, it's a spray that goes into the nose, and the nostril is a very good delivery system for drugs in that the medication is absorbed fairly rapidly. There's a 2 milligram dose for essentially adults at this point, but there has been a 1 milligram dose that has been studied in children as well. So over time, we believe that there will be both doses available. And I think it's nice to see advances in food allergy and anaphylaxis generally. It's really, really nice to see new epinephrine devices coming because it's always good to have options and selection. And certainly from a safety population point of view, it's nice to have different products available to us so that we always have some access to epinephrine in Canada. So we're optimistic that this will be here, and we're excited to have a different option that is not a needle.
Great. Okay. Well, thank you very much, Dr. Kim. And I just want to reassure the listening audience. We've been in contact with ARS Pharmaceuticals, who are the makers of neffy, and we're also encouraged by the fact that they have a great deal of interest in the Canadian market. So we'll continue to follow the developments on that, and we will keep you updated through our newsletter as things progress. So stay tuned for that. So thank you, Dr. Kim. I'm going to ask you to turn off your webcam, and I'm going to turn off mine. And we just have a final couple of comments and slides to walk you through. So following the session today, you'll get a short survey through GoToWebinar that asks for your thoughts on today's webinar. Please do take a moment to complete it. It informs our educational programming and provides us with insight on other topics that you would like us to cover. Back to school is underway, and if you haven't already, take advantage of the host of resources that we have on our site. Go to foodallergycanada.ca/back-to-school, and there you'll find videos, handouts, and hacks like the one that you see on the screen, and more. And please also do get involved in our More Than Peanuts social campaign. It's about creating awareness for all allergens to help prevent reactions. The posts are insightful and they're shareable, and all you need to do is share the posts and help us broaden the reach of the campaign. In this topic around anaphylaxis resources, and certainly there's lots of good conversation about getting those plans in place to know how you're going to handle those situations. We've got a lot of resources that can help you do that. You can access them at foodallergycanada.ca/anaphylaxis resources. Really would encourage you to take a look at our videos with Dr. Philippe Bégin, in which he explains what happens to the body when you have a food allergy and when experiencing anaphylaxis, and how epinephrine actually works to treat that reaction, and why it's important to give it promptly. Watch it yourself, share it with others. It's engaging, it's kid-friendly. We also have other sessions and webinars on the topic of anaphylaxis, along with our epinephrine signs and symptoms and 5 emergency step sheets. Now, in terms of upcoming events, we've got 2 webinars in September, one on the psychosocial aspect of managing food allergy, and the other on kind of understanding the differences between food intolerance versus food allergy. You can register now for those events at foodallergycanada.ca/events. And also, and you heard Michael talking about this, the fall session of our Allergy Pals and Allies online mentoring program starts on September 21st. This program connects kids with food allergy ages 7 to 15 from across Canada and has been life-changing for the participants. I'd like to thank the following Back to School campaign sponsors for this event: EpiPen, the Peanut Bureau of Canada, and Chapman's Ice Cream. Thank you for your participation in today's webinar. You can view a recording of this webinar at foodallergycanada.ca shortly. Please also share it with others who may benefit from the content. This now concludes our webinar.